Hello, everyone. A very, very good afternoon to all of you. This is Swarnima, and we are here with another session of the Femtech Next conference. Very, very glad to have with us Mr. Jitendra Haryan, who is currently the CEO of Jaslok Hospitals and needs little to no introduction in the medical fraternity. Has a strong finance and operational background, but I'd love to, sort of take it over to him so that he can tell us a little bit more about his journey, and we dive right into all the conversations that we want to have. Hello, Mr. Jitendra.
Hello, hi. So I'm Jitendra Haryan. I am with Jaslok since last 9 years, and before that, I was with 7 Hills Healthcare for about 4 to 5 years. So that's my healthcare journey. I'm a chartered accountant and true hardcore finance guy, but
Yeah,
now I'm in the different roles for last
yeah,
5 years. So
yeah.
that's my healthcare journey.
For everyone who's been watching Femtech Next, you know that we've been having conversations around policy, around women's health, around culture, etc. Today, what we want to bring today is a very, very important, sliver that we, almost never talk about is the idea of in-clinic and digital collaboration. So we couldn't think of a better person than Mr. Jitendra to sort of address that. Sir, the Indian hospital industry in India is accounting for 80% of the healthcare market, and the bulk of the revenue it continues to be IPD. However, we've also seen, the growth of digital health startups. So, how have you seen this kind of coexisting journey evolve, and where do you see this going?
Yeah, so firstly, I would say the onset of COVID has accelerated the use of telemedicine and digital platforms. So and telemedicine increased the access to healthcare during COVID and substantially bridged the gap between demand and supply situation on hospital beds when situation was overwhelming. I would say India is embracing digital health at a rapid pace. We believe that the digitization of India's healthcare ecosystem will optimize the practice of our doctors, enhance patient-doctor communication, and improve patient outcomes. Use of telemedicine also reduces the cost of healthcare, especially indirect costs on account of travel, besides saving time and adding comfort value. We nowadays have seen a lot of growth in the healthcare app monitoring apps as well, and that's good. So that especially after COVID, people have become rather more health conscious, and these apps are helping them to monitor their health, and that is improving. In fact, certain things they can share with their doctors, and doctors can also be aware, especially on the chronically ill patients, what's going on, and they can keep a tab on his health as well. So I would say this is really helping well from patients' health perspective and outcome perspective. And I think we are only seeing the beginning. Probably this is going to grow further, and as a whole, it will improve the overall healthcare scenario as far as patients and hospitals are concerned.
Yeah. Yeah, no, that's right. I think one of the things that's happening in the last sort of decade is the advent of telemedicine and digital health. And another thing is that we're seeing a bit of a break away from gender agnostic healthcare and more in terms of women's health, elder care, diabetes health, etc. So in that spirit, as of the financial year of 2020, the mother and baby care was basically accounting for 8 to 9% of the hospital market in India. And we are also seeing a very rapid rise of the super specialty, obstetrics and maternity facilities. So, how do you see, the evolution of women's health evolving in this decade, both in clinic but also digitally?
Yeah, so and rather it's going to, I would say, it's going to grow in at a good pace in coming times. So women's health, let's say that it must be a top priority for the entire country, with the support of specialized healthcare professionals and cutting edge medical technologies. As the field of women health evolves, women today are becoming more aware about their health. I firmly believe that in the coming decade, women will take more accountability and ownership of their health by doing regular routine health checks to understand their healthcare requirements. This will also be supported, as I said, by the healthcare apps, and now there are specialized women care apps as well, many of them, which will enable them to book appointment with doctors, address their specific issues, Also, to keep health records and keep track, keep their health under track. Uh, Also, having said this, I feel that no doubt the number would gradually increase, or rather at a rather more pace. But it's still a question, that whether it will reach to a sizable women population. So that is something that we have to see.
Yeah, yeah. Right. So, I mean, that's right. I mean, when it comes to, the sizable women population, that is a big thing, especially when we're talking about the digital revolution. There are how many women? I mean, we're always talking about that. Of course, there are a lot of women, there are a lot of issues, but how many women are online and how often are they transacting online? So that is definitely a huge gap that is still there. So, you touched upon how this is kind of helping. So femtech is, very rapidly transforming, the way in which women are accessing healthcare. Now, you mentioned a few things. There's personalized care, there's tracking, there's monitoring. Now, but this is just part of the picture, right? At the end of the day, women do need diagnostics, they do need physical examinations, etc. So how do
Correct.
you feel that, when it comes to women's health specifically, that there's already sort of, there is a data deficit, and then there's an awareness bridge as well, to be crossed. So how do you see, the collaboration between digital health clinics or digital health, apps and in clinic collaborations like really impact the outcomes of women's health?
Yeah, so this femtech is now probably the most talked about development in the healthcare right now, and it's good that there are so many platforms available for self-monitoring of various needs of women. But it's important to have collaboration with the hospitals and service providers to address problems in time. So of late, we are seeing a movement in this space quite a bit. In fact, we are also talking to one or two providers in this direction, and that is not specifically for women, but for the patients in general. With the help of these technology platforms, hospital can deliver better patient care. For those who prefer in-clinic visits in time, rather, basically it kind of gives signals to the patients, and if it is kind of if there is a kind of partnership with the hospitals, because it should not just be app which tells you what it is, and after that one doesn't know what to do about it. So if there are partnerships with the hospitals, with the service providers, it can really add value to the users. So it also would help patients with the better access towards the right healthcare needs.
That's right. I mean, like we say that, when it comes to especially things like PCOS, endometriosis, and various other conditions which are only now being spoken about in the last decade, especially in India, it does require long-term continuous care, and it's not up to just the hospital or just the digital clinic. So yeah, that's right. I mean, in terms of collaboration. Now, another thing that we hinted upon in the previous conversation is that there is specialized care that's becoming more and more popular. So, personalized and integrated care is becoming an important priority for people, especially like you said after COVID-19, where people are saying that like health is not just the absence of disease. Immunity. These things are becoming like the buzzwords these days, and an understanding of that is also the same. So, and this is more so for women because most conditions, with hormonal health, for menopause, for postpartum health, it requires a degree of, balance between both clinical treatment and holistic lifestyle management. So, where do Indian hospitals, stand on envisioning this kind of a robust integrated care, where hospitals are where we're in a country where the doctor's word is the final word. The hospital, the brick and mortar hospital, is still the space of trust. So, in what ways are hospitals looking at beyond the clinical and integrating those robust, non-medical services as well?
Yeah, so see, it will still take time, to get there. But I would say the beginning has already happened.
Yeah.
Hospitals are going to be instrumental, when it comes to healthcare. But a lot is changed. A lot has changed already, I would say, in last few years. Digitalization is altogether a different subject now, when we talk now and 3 years back. Today, patients, think whether they necessarily have to come to the hospital, or they can talk to their doctor, or a hospital and continue the care at home. This has empowered them and certainly improved the health related quality of life. Today
Yeah.
patients from other cities or even outside of country can talk to our doctors and take the follow up from place of their comfort. So technology continues to play an important role in ensuring this personalized care and improvement of health related quality of life. Every hospital is working on this aspect, and as I said that we can see a significant progress probably in next 2 to 3 years time, and that's going to be good for the patients. Like at Jaslok now, what we have started something like Jaslok Genie, whereby you can book your online appointment, see your reports, medical history, make online payments, and many other things, just by using one single window. So these things will happen. This is just the beginning, but I would say we will see a lot more progress in this direction in next few years.
Mhm. From the perspective of the end user, since you mentioned a lot, and I'm glad you mentioned the health-related quality of life, which as of today the WHO considers to be a very important healthcare metric. But of course, the world over, we're still a ways away from incorporating it as a clinical metric. From the perspective of the end user, right? How have the expectations from the clinical experience evolved? Because we're also seeing that COVID has given us a very mixed sort of, it's been a mixed experience. On one hand, we really see that doctors are the backbone, people, like medical professionals have gone above and beyond. But at the same time, from the public health perspective, we know that there are many gaps to fulfill, be it data, hospital capacity, whatever it is, right? So,
Yeah.
how are people's outlooks changing, towards the kind of healthcare experience that they want, and in what ways are modern hospitals adapting to
Yeah, so see, typically, in any other service industry, what customer expects is value for money and the best experience. From patient's perspective, if I simply put what he expects from the hospital is the best clinical outcomes and the hotel-like experience when it comes to the hospital, right? But now that equation has, further gone beyond it. So today, patient would say, how can he be connected to the hospital, while he's walking, while he's doing his other chores. So basically, he wants kind of more and more value to him. So how can we prevent any mishaps when the patient is not in the hospital? So if he's a regular patient, how can we track his health while he's not in the hospital? Now these are the things that are going to be important, and technology is going to play a big role in ensuring this. So the perspective towards hospital and people's outlook towards the kind of healthcare they want continues to evolve, and this is going to, as I said, it's going to become altogether different. His expectations will not be just that when he comes to the hospital, but it's also going to be beyond that. And the hospitals will have to adequately manage these expectations to have better patient outcomes and also to give him that further added experience. So today I would say that the hospitals are striving towards this particular thing, at the back of the advanced technologies, and we are also working in that direction. So, but and as I said before that, we will see a significant change in this space, in next 4 to 5 years. Uh, we are a 5 decade old hospital now, and I would say our journey also. I mean, I'm here for last 9, 10 years, but in terms of the patient expectation, what I'm saying, there's a sea change, and today, everybody talks digital. Everybody talks about what more and how can you further the value that you are getting any which way. So I think this whole equation is going to be different in the next few years, and it's all going to be at the back of not only these digital apps. Digital apps will be important, of course, but I think there will be now the bridge between these apps and the hospitals or the service providers, whereby the patient will be empowered and he can extract more value, and that will probably improve the his healthcare expectations and the patient outcomes.
Yeah. Yeah, no, just as a final sort of thing, because like you said that I think COVID has changed the mentality. So I think most of us can probably not remember a time before COVID, especially when it comes to healthcare. Like the entire language around healthcare has changed, and COVID is far from gone from our system.
Correct.
Just as a as a final word on, so India is not exactly known to be a country that focuses a lot on preventive healthcare. It's a very even less so in women. Where even until the symptoms become very disruptive, they do not they're not able to prioritize. Have you seen a huge change after COVID-19? And here I'm only talking about in terms of, spends and, hospital bottom line priorities as well. That how much is prevention becoming a priority for people? And, what are some ways in which medical establishments and even digital companies like ours will really make that push for prevention?
So I think I would say first of all the health awareness has improved, increased substantially. After COVID, people have realized that they have to take their health seriously, and so that's a good change. The Other than that, even I think the governments are playing a big role, in ensuring certain amount of preventive health. Like we saw recently BMC going door to door and checking the blood pressure and of the elderly patients. So we will see more of this, and if all the stakeholders work together, I think it will change the whole landscape. Uh, uh, I think from hospitals' perspective, also we are also taking a lot of initiatives in terms of having. Uh, uh, I would say, of course, we are promoting the health checkups and preventive healthcare, but we have to have blood patient monitoring clinic. We need to have heart failure clinics, and these kind of things we are already doing to kind of detect problems early. Other than that, I think people as such have also started looking for some solution. So doing health checkup in a year or in 6 months is one thing, but how can you day to day monitor certain key parameters of your health? So people are now, I think, uh, I know, in like generally people wouldn't do, my friends or people in my circle, but I'm seeing that 5 out of 10, now they're having BP
Yeah.
apparatus. Then your what is this? They're using this digital
Some
health
stupid
watches,
health
okay,
watches.
to check the heart rate and oxygenation, etc. So these things have evolved, I think, over last 3 years or so, and that is because of COVID, I would say, I think, and this is going to further improve, and it is good. I think it is good when it comes to more of preventive health than going to the hospitals when it's
Yeah.
required.
Yeah, no, that was very insightful. Thank you so much. You're absolutely right. I think in terms of the health trends that we're also looking at, we're seeing a lot of, changes across different strata of the society, where everyone is, looking at health-related quality of life, which is I'm so glad we normally, it's an important metric that a lot of people are talking about it. That it's not just about, say, giving birth, but what happens after that to the health of the mother and
Correct.
child, and the father, who's also a new father and dealing with a lot of things. So. Thank you so much, sir. And it was wonderful speaking with you. And we really hope that we see more collaborations between digital initiatives and, like you said, the very critical piece, which is the hospitals, to ultimately enhance the patient experience. Thank you so much. It was really wonderful to have you, and we deeply appreciate your insights.
Thank you for this interaction, and my best wishes to Gayatri app as well.
Thank you. Thank you.
Thank you.
It really means
Thank
a
you.
lot. Thank you.
Thank you. Thank you.